Good morning, sir. Should I start? So I'm presenting a downtrend of ROP incidence in India. It's a unique neonatologist-based survey. ROP is a vasoproliferative disorder of retina seen in premature infants and is leading cause of preventable childhood blindness throughout the world. From our database of ROP screening in Girdhara Institute, we have observed significant decrease in incidence of both total ROP and treatable ROP from 2015 till date. Incidence of treatable ROP has decreased from 10% to 4% from 2015 till now in our database. There are many ophthalmologist-based online surveys for ROP screening and treatment, but to the best of my knowledge, this is the only neonatologist-based online survey done to understand how neonatologist management for premature babies has modified ROP incidence. It is a Google-based survey circulated by WhatsApp and Facebook, done during the month of May and June 2023, and questionnaire was validated by sample survey done by a small group of neonatologists. 24 questions were asked and 46 neonatologists participated in the survey. This is a question circulated. Out of these 46 neonatologists, 12 were from outside Kerala state. 89% neonatologists were from private sector and 91% neonatologists manage level 3 NICU. 50% neonatologists manage more than 10 premature babies deliveries per month. It's a good number. 89% neonatologists have in-house ROP screening facilities, whereas 8% send outside and 2% not do ROP screening at all. 78 never missed ROP screening, whereas 22 missing ROP screening because of various factors. 17% even now not aware of current in ROP screening guidelines of India, and 20% even now following the older ROP screening guidelines, which is a quite big number. 76% neonatologists suggest ROP screening at 1 month of birth, but 24% screening anytime after birth. 56% neonatologists still believe less than 31 weeks of gestational age is the criteria for high-risk premature babies, which is not correct. What current ROP screening guidelines says, all premature babies less than 2000 grams or less than 34 weeks of gestational age should be screened, and first screening should be done before 1 month of birth. High risk preterm is less than 28 weeks of gestation, not 31 weeks. And with multiple systemic factors, ROP screening can be preponed to 2 weeks, but not any time after birth. ROP pathology says that vaso-obliterative phase seen at birth is due to high oxygen supplementation, which take 2 to 3 weeks to reach vaso-proliferative phase after birth, which is the main responsible cause for ROP screening. Thus, ROP usually does not prevent before 3 weeks of premature birth, and thus there is no need of doing ROP screening before 3 weeks until baby has some serious systemic cofactors. 50% neonatologists follow strict guidelines for 7 gram percent hemoglobin for blood transfusion. 28% agree to transfuse blood even at a higher HB of 8 gram percent, but 22% don't know any guidelines for blood transfusion. What guidelines says? Blood transfusion should be done at HB of less than 7 gram percent, but higher risk neonates can be transfused at higher HB cutoff of 8 or 8.5 gram percent. It also says a restrictive transfusion approach should be recommended over liberal transfusion for premature baby, that it usually shut down the bone marrow. Recent up-to-date guidelines, what has been published in NNF and other for pediatrician, says that 7 gram percent is a standard cutoff for blood transfusion, but also says cutoff can be raised to 8 gram percent in infants with multiple systemic risk factors. These are listed in the blue box. Unfortunately, they have not included worsening of ROP as a high-risk guidelines for blood transfusion. 15% neonatologists even now prefer to give 100% oxygen supplementation for resuscitation at birth, which is very risky, while 87 to 90% neonatologists prefer to use room air, blended oxygen, CPAP, Neopuff for oxygen blenders for neonatal resuscitation at birth. Various meta-analysis, stop ROP study, and recent NNF guidelines says that high saturation target of SpO2 of 90 to 95% is good for reducing infant mortality, but SpO2 of 85 to 90% should be attained for ROP prevention. It is less than the what we know, everyone knows. It has also been published, recommended by NNF. So study says that babies, that before birth, fetus has blood oxygen saturation of approximately 60%, which increases to 90% over approximately period of 10 minutes, which in a extreme risk premature baby can be done with various methods. This is given by blended oxygen resuscitation with 21% in babies more than 35 weeks, but in baby less than 35 weeks, which are very extreme premature, oxygen, little bit high oxygen of 21 to 31% should be given for resuscitation. And Neopuff is a very good method which neonatologists use for with blended oxygen nowadays. There are variable response of neonatologists regarding ROP worsening with various risk factors like days of NICU stay, antenatal steroids, IUGR, hypotension, thrombocytopenia, and hypoglycemia. Various studies also say that these studies risk factors are not highly associated with risk factors for ROP worsening. Neonatal management in first 60 minutes of birth is called as the golden hour management, is very important for future premature baby life. And early breastfeeding and good kangaroo care should be promoted for better neonatal survival. So to conclude, 22% neonatologists even now missing regular ROP screening. 20% neonatologists even now not aware of current Indian ROP screening guidelines given by RBSK. 15% neonatologists even now prefer to give 100% oxygen supplementation for resuscitation at birth, which is really very harmful. A collaborative approach by a neonatologist and ophthalmologist is needed for ROP prevention and good infant survival for future. Thank you, sir.
This is important information, but your paper is actually titled Downtrend of ROP Incidence in India.
Yeah, sir, actually, we have seen downtrend, but I studied that and did a survey between the neonatologists. So why we in the awareness? Yes. No, this actually this is not an ophthalmology based survey, sir. So this is basically a neonatologist based survey. It's a probably first survey. It's difficult to understand how
No,
they have.
I understand,
Yeah,
doctor. What I'm asking you is because your title is Downtrend of ROP Incidence in India.
sir. Actually, now I cannot change the title. What has been?
No, that's fine.
Ah,
I'm just
yeah, yeah.
so just I just wanted to confirm
Mm.
that.
So it was survey was done after sending the abstract. Pan India, sir, through WhatsApp and Facebook. And I have taken help from the neurologist of the Cochin. We are screening nearly 20 to 21 NICUs every week, sir. 46 we have done in our study, sir. 46. Neonatologist only. They responded, yeah. No, ma'am, it was not chosen. I made a questionnaire with the help of 3 or 4 neurologists, and this was distributed with the help of NNF. Whatever reply I got, I did it. So there was a various replies. In Kerala, what I have seen, there's a significant downtrend in ROP. So I was trying to understand why it has done, what has gone down in ROP in Kerala. But the way I got the response from all over India, there's a very no. In Kerala, we have seen significant reduction in ROP, sir. Indian incidence is nearly 15. Incidence has come down. Incidence has come down significantly. Both, both.
In the last how many years have you seen?
Sir, nearly I am doing screening since 2015, and the ROP incidence for both total ROP and incidences in Kerala, I have seen significant downtrend. Nearly 10% of treatable ROP has come down to 4.2%.
So, do you think the COVID outbreak had anything to do with that? Because a lot of assisted reproduction programs stopped during that time.
COVID, there was minimal rise, sir. In my table, you saw there was a highlighted thing in between the table. That time incidence got little high, but then again
Yeah,
came down
because
in the COVID time.
during COVID you had less assisted reproduction, so the results you will see a little after that only.
No, we are following that baby, sir. We are constantly following those babies, and luckily we didn't stop the ROP during that COVID timing. Also, we are continuing that. S- Sir, what I feel is here in Kerala, neonatologists are aware they are giving little bit higher. They cut off. They are keeping little bit higher cutoff for HB transfusion. Strict guidelines what everyone follows is 7 gram%, but here people doctors are following 8 gram or 8.5 gram%. They are not using 100% resuscitation at birth. They are using neopuff, what I mentioned, to give oxygen supplementation. So 21 to 30% is their oxygen supplementation, which is reducing the ROP incidence, and periodic follow-up obviously is doing. So, and first golden hour, what I mentioned, especially first golden hour, which has been not been documented by anyone, but yes, golden hour management probably is a very major cause even for sudden surprises in ROP worsening. It's awareness basically. It's the first survey I just I did. Since I have sent the topic, I could not change that. Thank you, sir.